Hello, my name is Dr. Phil Lanew, and I am going to talk to you about what is a DO and also what is osteopathic manipulation. So both myself and Dr. Pasma are doctors of osteopathy, or DOs. We go to a 4-year medical school, similar to MD, but on top of our medical training, we also get trained in hands-on diagnosis and treatment. Similar to chiropractic, but also a little bit different. So what we do, it entails on taking a really good history when you come in, making sure that we can get a really good structural and physical exam, including testing nerve function, muscle strength when indicated. Based upon these exam findings, we are able to tell from previous history, either from what you've told us or different tensions in your body, that we are able to formulate the proper treatment necessary in order to help restore normal health and function. I'm going to use an example to kind of explain it a little bit better, so hopefully that you'll be able to understand what I'm talking about. For example, if somebody's in a car accident, there's a lot of force that goes into that. For example, a whiplash injury. So the person typically has their right foot on the brake. They get rear-ended, you get a lot of impact that goes up that right leg into the low back, the right low back. Their neck swings forward and then whips back. So you create this cervical pain up in your neck. A lot of times people get headaches as well, but then often they get low back pain, whether or not that is the main cause or the main problem. That kind of just is specific on the patient. So what we look at is we look at, first of all, the breathing. You might ask, why is breathing important? But a lot of times when we're in impacts like that, it causes us to lock down our diaphragm, so we no longer breathe as well. So a lot of times these patients that come to us after they've been in a car accident for a long period of time, they have a difficulty breathing, so therefore they become more fatigued. They might feel like they're more anxious. They might feel like they're just not themselves after that injury. And a lot of times it has to do with the fact that they can't breathe anymore. I'm sure most of us have had the wind knocked out of us. It's not that fun to go through. So what we do is we assess their breathing. We help to put some gentle pressure down on their diaphragm to allow breathing to be restored back to normal. As soon as breathing is restored back to normal, the patient often feels better, they sleep better, and then we can start to look at the different strains in the rest of their body. There's a thick connective tissue called dura that connects down to your sacrum and your pelvis, and it actually comes up and connects to the top of your neck as well as inside your skull and surrounds your brain. So when you have a whiplash injury, that actually affects that dural connection from the bottom to the top. So a lot of times you could work on the neck all day, but unless you address that dural tension on the bottom, you're not going to get anywhere. Or vice versa. You know, if somebody has low back pain, if they have a strain up in their neck and their head and they don't address the low back strain, that's not going to get anywhere. So we like to give a comprehensive look to our patients in order to help reestablish normal function. Most of our treatment techniques are pretty gentle. Sometimes patients get off the table and they say, it feels like you really didn't do anything. That's pretty typical, but normal treatment reactions for the first 1 to 5 days afterwards, a lot of times people have potentially worsening of symptoms, or they just feel a little bit more achy and sore. And a lot of times the reason for this is because those abnormal patterns, those abnormal structural patterns that they had in their body have freed up and gone back more to normal, and your body takes a few days to adapt towards that. So that is, in a nutshell, what osteopathic manipulation is. Another question you might have is, what condition does this treat? Not only does it treat musculoskeletal conditions such as whiplash injuries, sprains, strains, we also help with newborn infants that have trouble feeding, post-concussive problems as far as headaches, difficulty concentrating, difficulty with visual tracking. We also do, we assess the function of the connective tissue around your visceral organs. So sometimes we can help with acid reflux or other GI type symptoms. Another common thing we see is painful menstrual cramps. If it's a structural component, let's say that you were a gymnast when you were younger and you had a lot of compression along your lower abdomen from the bars, a lot of times when we get that tension out of there, we can help those symptoms go away. So although we do primarily focus on musculoskeletal problems, we also work on more functional problems, and we try to really assess the whole patient and figure out, you know, what is the best for you, what is it that you need, and really cultivate a very fine-tuned treatment in order to hopefully help you establish that. That being said, we typically, try 3 to 5 treatments. If you don't get better by that time or show some kind of change or positive improvement, we're probably not the people for you. But we will give our best and do our best to see if we can help you in any way possible. So thanks for watching this video, and I hope you have a great day.